Hi, everybody. I'm Mark Middleton along with Bill Schaefer, and we are here today with three primary objectives. We want to talk about how great life can be after the age of 65. We want to share the secrets to healthy aging, and we want to talk about the importance of Medicare because Lord knows it can be a bit confusing. In fact, more than half of those who are reaching Medicare age admit that they just don't even know where to begin.
You put your finger right on it, Mark. Not only knowing where to begin, but the whole thing can confuse people, which is why we put together Growing Boulder's outrageously interesting, dare we say, easy to understand guide to Medicare, and why we've put together this Medicare 101 Summit. We're going to cover the basics to kind of help you select the best plan for yourself and your family, because when it comes to healthcare, there really is no one-size-fits-all solution. So let's share what's coming up over the next 60 minutes. We're going to chat with Kevin Kenny, an expert who's worked in Medicare for several decades. He's the vice president of Florida Blue Medicare, and Kevin will be along to help us break down the basics of Medicare. Things like who's eligible, how and when do you enroll, and we're also going to talk about the different Medicare plans. Original Medicare Parts A and B, Medicare Part C, which is Medicare Advantage. What's that all about? We'll find out. And of course, we're all worried about prescription drug costs and need to understand what Medicare Part D is all about.
Yeah, this has been a learning experience for Bill and I as well. And of course, it would not be a Growing Boulder production if we didn't deliver the biggest message of all, and that is the importance of our personal participation in all of our own health care.
We do have control, don't we, Mark? Yeah, great insurance is important, but we have to understand we have a role in our future health and happiness. And that's why we'll also provide you with some great inspiration and resources to help you make the rest of your life the best of your life. We're going to share aging's ultimate no-brainer, too. We call it the power of prehabilitation. We'll explain the health-wealth connection. We'll tell you why the ability to adapt and accommodate is critical to successful aging, and the 5 keys to active longevity, things that we have learned from Growing Boulder's rock stars of aging.
All of that in the next 45 to 50 minutes. So let's get with it. What do you say? Because health is our greatest wealth, and because great health care can help us maximize the opportunities of age. If you know anything about Growing Boulder, folks, you know that we say congratulations on turning Medicare age, because 65 is not the beginning of the end. It is the beginning of what's next. We spoke recently with Kevin Kenny, who is a vice president of Florida Blue Medicare. Kevin is a true thought leader in the industry. So let's jump into that interview and learn why this is a very important time for the 10,000 Americans who are now turning 65 each and every day.
So we're about to go into the Medicare annual election period, which runs from October 15th through December 7th. And it's really the time of year where people are making their Medicare decisions, and they're choosing what products and benefits are important to them for the health insurance that they'll have for the entire next year. And so this is a really important time for our members, our providers, and even caregivers, because caregivers are so important in the decision of healthcare for members. I'm a caregiver myself to my mother, so I'm certainly involved in those types of decisions. So yes, it's a really important time involved for everybody in Medicare.
Let's go back to the very beginning if we can, because, I think most of us don't think about Medicare at all until we start getting, things in the mail and phone calls, or a friend or neighbor or relative says, "Aren't you 64 years old now?" So in the broad strokes, what exactly is Medicare? Because it seems like it's a pretty good deal.
Medicare is a government-sponsored program for individuals over 65 who have qualified for Social Security, and people under 65 who have disabilities, and then people who have special chronic conditions like Lou Gehrig's disease or end-stage renal disease. So it's a government program that has multiple parts to it, Mark, whether it's hospitalization, medical benefits, drug benefits. So it's really a comprehensive medical benefit for people who are Medicare eligible.
So you know what happens, Kevin, is we start seeing the ads and thinking about it and wondering, man, how do I get involved in this? How do we sign up? What's the best way, the best process to go about signing up for Medicare?
Sure. There's a lot of information out there in the market, really good information resources to go to. So probably the first place to start is Medicare.gov has a great website where you can compare plans in your zip code. And that's the key, is finding the right plan that fits your needs, making sure your doctors are in your network, making sure your drugs are on the formulary, any prescription medication you take, but also making sure they have what we call supplemental benefits, things like dental, hearing, vision, things that are important to you as you age. And so Medicare.gov is probably the first place to start. But then, at least within Florida Blue, we have neighborhood centers that you can call. Traditionally, you can stop by, but during COVID, that's not available. But you can call our member services area to get information or speak to one of our sales agents. But there is a lot of information out there, and it does take a while to comb through it to understand exactly what your needs are and what's important to you in your healthcare.
You know, I always like it when our healthcare leaders are not just smart, but they're really good people as well. And you can tell that Kevin Kenny is that. We're going to get back to Kevin in just a minute, but here are the takeaways so far. Medicare is a government-sponsored healthcare plan that is primarily designed to help seniors who are age 65 and over cover some of their healthcare expenses. So to be eligible, you have to meet one of the following requirements: age 65 or older and a U.S. citizen or a permanent U.S. resident who has lived in the U.S. continuously for 5 years before you apply. You can be younger than 65 and still receive Medicare if you have a qualifying disability, and you can qualify at any age if you have a diagnosis of end-stage renal disease or ALS.
Right. So if you're turning 65 in the next year, you can enroll in Medicare during the 7-month period that surrounds your 65th birthday. This is called the initial enrollment period, or the IEP. It includes the month of your birthday, the 3 months before, and the 3 months after. Now, Kevin mentioned the annual enrollment period, the AEP, that runs from October 15th through December 7th. This is the time you can enroll in original Medicare. You can switch plans, you can drop or join a Medicare Advantage plan, a Medicare supplement plan, or a Medicare prescription drug plan. Whatever decisions you make become effective on January 1st. Now, finally, there's an open enrollment period, the OEP, and that runs from January 1st to March 31st. This is the period where if you have a Medicare Advantage plan, you're allowed to switch to a different Medicare Advantage plan, or you can even return to original Medicare Part A and B coverage and join a standalone Medicare Part D prescription drug plan.
All right, before we get back to Kevin Kenny to ask him about these different parts of Medicare, here are some great resources to help you sort all of this out. Growing Boulder's outrageously interesting and, dare we say, easy to understand guide to Medicare is available. There's a link below that will allow you to download this really fun and informative guide at no cost to you. It's our gift to you. Kevin mentioned Medicare.gov, which really is a great resource. It'll help you find plans in your area and explain details about all of the different kinds of Medicare options. And finally, at growingboulder.com/Medicare, we've got a forum that can connect you directly with Florida Blue Medicare, with Kevin Kenny's team, to learn more about your options.
Now, if you need more inspiration, all you have to do is scroll down on this page, because we've got these resources and more, including our downloadable PDFs featuring some of our favorite takeaways and Growing Bolder whiffs. And what these are words of wisdom and tips on how to live an engaged life from some of our famous friends. And remember, you can return to this page at any time at growingboulder.com/Medicare Live. Now, according to the Centers for Medicare and Medicaid Services, healthcare costs will continue to grow over the next decade. You probably figured that one out on your own. Understandably, one of the biggest fears that, well, all of us have is that we'll run out of money before we run out of time. And this is why we talk a lot about the health-wealth connection.
Yeah, it is impossible to improve your health without also improving your wealth. The two are inextricably combined. In fact, the number one investment that we can all make beginning right now, the one that will have the greatest rate of return in our future, is simply investing in our overall health and well-being. Now, our friend Ann Call is pretty much the poster girl for the health-wealth connection. She's now in her early 90s, and you will be amazed at what she spends, really what she doesn't spend, on healthcare and prescription drugs. Listen to this. First question is, what are your total healthcare costs over the last 2 years?
0.
Second question, how many prescription medications are you currently on?
0.
So let's find out how you do that, because you really have come to represent what is possible when you leverage this health-wealth connection. I don't want to ask personal questions about your financial situation, but I'm guessing you're not a wealthy woman.
No. I'm not wealthy. I have Social Security. That's pretty much it. But my house is paid for, my car is paid for, so that helps. I don't have those kinds of payments, mortgage and so forth. And I'm very careful how I spend my money, extremely careful.
So let's talk about the lifestyle choices that you make, because I know the number one thing is that you keep moving, you stay active. What kinds of things do you do? What do you believe in?
I believe in doing some kind of exercise every day. It doesn't have to be a lot, it doesn't have to be intense, but just a simple walk for 30, 40 minutes. If you do that almost every day, that is a huge help. I just love to be active, and I find that it brings me happiness and health and strength to do what I need to do around the house, lift things, move things.
One of the problems I think that we all face is the fact that we live in an ageist culture, and we are subjected 24/7 to messages on the television primarily, but everywhere that tell us that this is what aging is supposed to be like, that we need the help of prescription medications, that we have to be ashamed of who we are and what we look like. How do you overcome all of this incessant negative ageist messaging?
I laugh out loud at the TV. When I see those pharmaceutical ads come on, all these people that look so happy because they're taking these drugs. Then they tell you all of the side effects. There's a long list, including at the end, death. Okay. And then, oh, by the way, ask your doctor if such and such is right for you. I can't believe, it's hysterical. This machine that we have, this body, is spectacular when you think of it. It runs automatically. You don't have to remind yourself to breathe. You don't have to remind your heart to beat. It does it on its own. But the best of it all, there's a computer up here, a built-in computer, a brain. And it's by far the best computer that man has ever devised. God has made this, but people disrespect it and they abuse it. That is why they suffer. Happiness is a big part of it. To be happy as you age, I have had the most wonderful life, full of challenges, but a fantastic life. And I'm now at the point in my life where probably the happiest I've ever been, because I have my freedom, my independence, and my health. What more could you ask? No, even money would not make me any happier, no.
You are also a poster girl for compressed morbidity. The notion that even though we may not extend the length of our life, we can all extend the period of disease and disability at the end of our life, which is really the ultimate goal. You, as I said, are the poster girl, and you mentioned dying not long ago in this interview. If you were to drop tomorrow, you have not suffered a single day of disease and disability. That feels good.
Yes, because I think a lot of these people who are letting themselves get to the point where they develop diseases that they could have prevented are very selfish, because they're setting themselves up to be a terrible challenge for their families. Someone's going to have to take care of them eventually, and aside from nursing homes and so forth. I have been caregiver for my husband, then for my father, and then for my sister, and I can tell you it's not an easy job.
And if your family can't take care of you, then society has to take care
That's
of you.
right.
So in a very real way, healthcare starts at home. We are
Yeah.
all our primary care provider
Yeah.
in a very real sense.
Oh, and the cost of everything is absolutely outrageous.
Well, Ann, thank you for your time. Thank you for your example, because there are far too few of you right now. But because of you, there will be many, many more in the
I
years
hope
ahead.
so. I truly do.
Bill, of course, we can't all be like Ann Call, but we certainly can learn from her example. We can all learn to leverage the health wealth connection.
Really important, isn't it? We talk about that all the time. We can all make informed choices when it comes to choosing the best Medicare plan. So let's check back with Kevin Kenny, Vice President of Florida Blue Medicare, as he breaks down the different plans that are available.
Healthcare is one of those stressful decisions because you don't want to get it wrong. Everybody wants to get the healthcare decision right because it's so important to them. So what we call original Medicare is Part A is your hospitalization. So if you need to go into the hospital for any reason. Part B is your professional services or your medical insurance, your traditional go into your primary care, your laboratory benefits, and things like that. Now, what the government did many years ago is they allowed private insurance companies like Florida Blue to participate, and they created Part C, which is called Medicare Advantage. And that is really bringing together Medicare Part A and B underneath a insurance company's point of view. And there's a fourth part to it, is Part D is your prescription drug benefits. And most of your Medicare Advantage plans combine Part D with them. So a Medicare Advantage is really the combination of Part A, Part B, and Part D to give you a comprehensive medical services.
Now, Kevin, I guess the reason that we need to even talk about a Medicare Advantage or anything else is because I didn't understand that Medicare A and B, while it covers a lot of things, there's a lot it doesn't cover.
That's right, Bill. So Medicare's Part A and B provide you with your basic health care if you need to go to the doctor's office or if you need to go to the hospital. But what it doesn't provide is all of these supplemental benefits like hearing, vision, dental. And as we've grown as a company, we are adding things that caregivers need and things that you as a member or consumer need. So we're implementing plans around transportation to help to get you to and from your medical appointments. We're adding things that address social isolation. So we have a great program with a company called Papa that is essentially grandkids on demand. So young college students coming into the home and working with you to either set up technology or help you shop. So there's a lot of supplemental benefits that we are wrapping around traditional healthcare to just enhance your healthcare experience and help you lead a happier, healthier life. With everything, there's limitations to all insurance. So Medicare Parts A and B, there is a 20% co-insurance on Part A, and your maximum out of pocket is unlimited. But what we're doing in Medicare Advantage is, first of all, we've set maximum out of pocket limits so that your expenditure is predictable year to year. The other thing around Part D, and that is as we age, and drug prices, or prescription drugs become more and more a part of our healthcare, we have implemented Part D and integrated that into our Medicare Advantage plans. And our formularies, cover about 2,500 different drugs, whether they're generics or specialty brand, all the way to, drugs to treat specialty conditions. So having that price certainty is certainly a big decision in your healthcare selection. And that's what we're trying to do with our Florida Blue Medicare products, is give you that affordability and that certainty of spend so that you have some protection.
You know, when you start talking about drugs, prescriptions, I mean, that frightens a lot of us because some of these can be incredibly expensive, and there are tools out there to help us mitigate that. And one of them is a word that's thrown around a lot that I didn't understand. I didn't know anything about. It's formulary. What is formulary, and what do I need to know about that?
Yeah, sure. Great question, Bill. So the formulary are the prescription drugs that are allowable under your plan. And so most formularies, you'll hear tiers, and you'll hear tiers 1 through 5. And tier 1 is your, low cost generic brands, all the way to tier 5, which is your specialty drugs to treat chronic conditions and other medical conditions. And there's about 2,500 different drugs on these formularies. And the formularies are developed in collaboration with physicians, pharmacists, nurses. A whole host of healthcare professionals are designing these to really meet comprehensive healthcare needs. And sometimes you'll find that a health insurance company has all of your drugs on the formulary, and sometimes a drug may not be on the formulary. And so you can always ask your doctor if there's an alternative to what you're taking. That would be the first course of action. And then the second thing is you can always talk to your health plan to see if they can make an exception. If it's a drug that is important to your condition and there are no other alternatives, there's absolutely a process to make exceptions as needed.
Does the Florida Blue Medicare Advantage policy include Part D coverage? Is prescription drugs, are they included in all of your Medicare Advantage plans or just some?
Yeah, no, they're included in most of our Medicare Advantage plans. Now, we do have certain Medicare Advantage plans that are for a targeted population. So, for instance, if you have prescription drug coverage through being a retiree from the military or a veteran from the military, you can select plans that have both Part C and Part D combined, or based on your need, you can choose a Medicare Advantage only plan that just covers the medical coverage. So there's options for you regardless of your situation. So we try to cover a whole host of people and what their healthcare needs are.
All right. If your head is spinning, understandable, because Kevin covered a heck of a lot of ground right there. Here, though, are the broad stroke takeaways. Parts A and B are original Medicare, and that's made available by the federal government. Part A is also called hospital insurance, and it covers care that you receive while in a hospital or skilled nursing facility, and in some cases, care that you receive at home. Now, most of us won't pay a monthly premium for Part A. That's what all of those Medicare taxes taken out of your paychecks were for. Part B is called medical insurance. It covers doctor's visits plus many outpatient services and supplies like preventative care, ambulance services, and durable medical equipment. You do pay a premium each month for Part B. In addition, you'll have a deductible and a copay with Part B. That deductible is about $200, after which you typically pay 20% for each of your doctor's visits or outpatient services.
Yeah, something else really important to remember is that while original Medicare is accepted by most physicians nationwide, it typically has a pretty high out-of-pocket cost for treatments, and there's no cap to those costs. So depending on what your overall health is, your potential expenses are kind of limitless. And this is why Medicare supplement plans and Medicare Part C, also called Medicare Advantage, was created by private insurance companies like Florida Blue. So Medicare supplement plans, or Medigap, those fill the gaps in original Medicare coverage. They help cover copays, coinsurance, and deductibles. Now, Medicare Part C, or Medicare Advantage, this includes Medicare Part A and B, and usually Part D also, which is the prescription drug coverage. And we'll talk more about Medicare Advantage in a moment. But first, Kevin did mention Medicare Part D, the prescription drug coverage, and that's only available from private companies like Florida Blue.
Yeah, Part D is usually wrapped into those Medicare Advantage plans, but you can also purchase a standalone Part D prescription drug plan. In addition to a monthly premium, your cost will be determined by which of the 4 coverage stages you are in. So stick with me for a second on this. In the deductible stage, you pay for your prescription drugs until you meet your yearly deductible. The maximum deductible for 2021 is $445. Some plans have no deductible, so you immediately enter the initial coverage stage. And at that point, you will pay a copay or a percentage of the drug's cost when you have a prescription filled. For most plans in 2021, the initial coverage period ends after you have $4,130 in total drug cost for the year. Then you enter the coverage gap stage, which is also called the donut hole. You've heard about that. At that point, you'll be responsible for 25% of the cost of your drugs. After your out-of-pocket cost reach a total of $6,550 for the year, you move into the catastrophic coverage stage, which sounds bad, but once you reach that point, you'll pay significantly less for your covered drugs for the remainder of the year, usually about 5% of the retail cost. So if you do take a lot of prescription drugs, Part D coverage or Medicare Advantage is something you definitely want to look into.
You know, something else, Mark, that Kevin talked about was the formulary. That's a pretty big key term when it comes to Medicare coverage. That basically is the list of drugs that are approved by the FDA that are covered by your particular plan. So most formularies break these prescriptions down into 5 tiers of drugs that are covered. In general, the higher the tier, the higher the cost of the drug, and the more you end up having to pay to get it. So always ask to see your plan's formulary to make sure that your prescriptions or suitable alternatives are on it. One word of caution here: if you don't join a Medicare drug plan when you're first eligible and you don't have sufficient drug coverage from another source, you may have to pay a late enrollment penalty if you join later. The penalty is in addition to your premium each month, and it lasts for as long as you have the Medicare drug plan. So before we get back to Kevin Kenny to learn more about Medicare Advantage, which is a big topic, a reminder that the greatest health insurance in the world can't keep us from getting injured or suffering a series of health setbacks as we age, because that is part of life.
Yeah, that's why we believe that prehabilitation, which is simply preparing for the inevitable challenges that Bill talks about, really is aging's ultimate no-brainer. And here's why: because we will all suffer these inevitable setbacks. It's part of our biological condition. And the extent of and the speed of our recovery after we experience them is determined by our overall fitness at the time, how much we're prehabilitated. You know, Orville Rogers is pretty much the poster boy for prehabilitation. He started running when he was 50 years old, and at age 93, he suffered a major stroke that pretty much paralyzed the entire left side of his body. Now, of course, most 93-year-olds would never fully recover from a stroke of that magnitude, but Orville was prehabilitated, and he demanded a rigorous rehabilitation program. He spent nearly 2 weeks in a rehab hospital, and after that, several months as a daily outpatient. And if you want to know what the result was, take a look at this. 7 years later, at age 99, this is Orville on the left in the Masters Track and Field National Championship, running against 92-year-old Dixon Hempel, who was also prehabilitated when he was hit by a car while riding his bike, suffering a collapsed lung, several broken ribs, even a shattered pelvis. Ultimately, he needed a total hip replacement. Now, by all accounts, these guys should both be in wheelchairs. And take a look at the finish. Orville wins by 5/100ths of a second, setting a new age group world record. You know, I love that video, Bill, and it really does, illustrate the power of prehabilitation, because even a serious stroke in his 90s did not sentence Orville to life in a wheelchair. Far from that.
You know, it's such a great point for everybody out there to remember things do happen in life, and you have to be prepared. And that's why we have another great example of prehabilitation. Dottie Gray was 93 years old. She fell out of bed one night. It happens so often. She fell out of bed and she broke her hip. Now, doctors told her daughter that Dottie might not survive the surgery, but she did. And then her physical therapist said she probably would never even walk again without a walker. And she said to her daughter, maybe she'd be better off in a wheelchair. Well, take a look at Dottie 1 year later at the age of 94. competing in the 100-meter dash at the National Senior Games. Who does this? And it wasn't a miracle. Dottie proved everybody wrong, not only by surviving the surgery, but by bouncing all the way back at the age of 94. How did she do it? She did it because she believed that more was possible, because she had the support of her family and friends, and because, as Mark says, she was prehabilitated when she broke her hip.
You know, folks, please don't dismiss Orville and Dottie's examples as unrealistic, because active longevity did not come easily to either one of them. In fact, it really didn't come to them at all. They had to go get it. Their overall conditioning at the time of their major health challenges gave them the opportunity to battle back and allowed them to resume living the life that they loved so much. So, really a great lesson there from both of them. And Bill, let's move on to Medicare Advantage, because I really like these plans, because, at Growing Bolder, we talk all the time that turning 65 is something really to celebrate, because if we do make positive lifestyle choices, just about all of us have the very real opportunity of 2, 3, and, maybe if you're like Orville, 4 decades of active life beyond normal retirement age.
It's such a great point you just made. Instead of dreading turning 65, let's celebrate it. And that's the advantage of Medicare Advantage plans. They provide a wide range of additional important lifestyle benefits, the kind Mark has been talking about. So let's find out more as we continue our conversation now with Kevin Kenny.
All of us want to lead a fulfilled life as we age. And so what we've really tried to do is wrap around all of those benefits that you need. So we want to absolutely make sure we have your medical and healthcare covered and your prescription drugs covered. But we also want to add in those other things. So for instance, fitness classes, wellness memberships, things like that help you lead your fullest life. And the other thing that's very important to us, and you'll see this in the Florida Blue community centers, is we are a part of the Florida community. We live here, we work here, our kids go to school here. And we want to be a fabric of the community. So we want you to be able to be a part of that and join in our community, so you have that socialization and that community feel, so we can help in all aspects of your healthcare needs.
But everybody talks about telemedicine these days. Is this an advantage for us, the patient, and is it included in Medicare or Medicare Advantage?
Yeah, telemedicine has been around for years. And, particularly in these unprecedented times, telemedicine is so important. Seniors have been disproportionately impacted by COVID and the environment we're in right now. So we have expanded our telemedicine or telehealth coverage to include not only primary care and urgent care, but also things like mental health counseling, occupational therapy, physical therapy, nutritional counseling. So as seniors are more and more hesitant to leave their home, we want to bring the appropriate services to their home in a safe and effective manner. So we have partners like Teladoc and New Directions and CareCentrix here in Florida that are bringing these services into the home of the member, so they don't have to go out and get these services. The other thing we're doing is we're working with our provider partners to help them enhance their telehealth services so that they can engage their members. And so we've got a lot of different provider partners that we are working with them to implement telehealth services into their capabilities. And we really want to meet the members where they are, and not just the members, but also the caregivers, to make sure that access to care is there during these times.
A great point, I think, to segue into something that I want to talk about a little bit, and that is just, the difference with Florida Blue Medicare. And I hope you folks out there know that Bill and I, we rarely, get behind any company for any reason. We're news guys. We want to be a voice of credibility. And, Kevin, I have to say that everybody that I have met on your team, without exception, is a very compassionate, caring individual. It does seem like your whole corporation, the culture of Florida Blue Medicare, is one of bending over backwards, trying to give people, the best possible healthcare service that you can. Is that just my perception and not true? I mean, what's it like to work for this company?
First of all, thank you for your comments. And you're exactly right. And this starts at the top of our organization. It's really embedded in our mission and vision and the values of the company. We are a Florida-based company. As I mentioned earlier, we live in the community. Our kids go to school in the community. So it's very important for us that we live out our mission, vision, and values. And what we want is we want everybody in the state of Florida to be healthy and happy, and we want to promote that. And I have to say, my boss, a woman named Kathy Feeney, is probably one of the most passionate people you'll ever meet about senior care. And Kathy carries around a bottle of Tums with her everywhere she goes. And the Tums aren't for herself. The Tums are to remind everybody on the team that we need to work every day to relieve the tummy acid of seniors, because healthcare is difficult and healthcare can be confusing. And it's our job to make healthcare easy, affordable, and accessible to all seniors in the state of Florida.
So when I'm shopping for this, what should I ask? What are the things that I need to understand? How do I know that I'm making the best decision for me?
Yeah, great question. And healthcare is really that. It's such an important decision for everybody. I know my wife stresses over this when we make healthcare decisions for ourselves, because we want to make sure we protect our kids. And so not only do you want to look for the basic things, what are the benefits of the product? Is my provider in network? Are my prescription drugs covered on the formulary? But we look for companies that we trust and companies that are here for the community. Florida Blue has been in the state of Florida. Last year was our 75th anniversary. And we have been here before hurricanes and after hurricanes, and we will always be here. So we hope to be that one constant in the state of Florida and for people. So the fact that we've invested in the local communities through our philanthropic work, we are supporting senior organizations who are delivering these services, and our neighborhood centers. We really want to be a fabric of the community. And so we truly want to be your healthcare partner.
Bill, I really love the fact that Florida Blue is not just a company that's trying to sell everyone a health insurance policy. It really is a neighbor trying every day to build community, to provide value, to be a source of inspiration and resources, literally in every part of the state of Florida.
Yeah, it's an amazing company, and we're grateful that we're able to get this kind of advice from them too. Like, instead of original Medicare, there are many seniors out there that are opting to enroll in Medicare Part C, which is that Medicare Advantage we were talking about. It includes all the benefits of the original Medicare Parts A and B, and many additional benefits designed to not just help you when you're sick and injured, but also to help you keep you healthy. These Medicare Advantage benefits might include prescription drug coverage, a network of preferred pharmacies to help keep your out-of-pocket costs low, home delivery of your medications at no extra charge, an over-the-counter allowance for non-prescription items, dental coverage for routine checkups, extractions, and more, even vision exams and an eyewear allowance, or hearing aids, fitness programs, rides to doctor's appointments, the pharmacy, and more, and neighborhood centers with nurses, personal health assessments, one-on-one assistance, events, and lifelong learning programs. And some even have gift cards for completing wellness visits and getting screened.
Now you know why I like Medicare Advantage plans. They include a menu of just about everything. Medicare Advantage plans also offer a choice between HMOs and PPOs, and there are many similarities between the two. But in general, a PPO will allow you a bit more flexibility, but it usually comes at a higher price. PPOs let you see doctors who are outside of the plan network, and you can see specialists without a referral. With an HMO, you choose a primary care provider who's in the network, and you'll usually need a referral to see a specialist. All right. As we all know, unfortunately, setbacks are a part of life. Some are related to age, but some we never see coming until they happen, and everything seems to change in an instant. I think the pandemic is a pretty good example of that. What determines our success moving forward after these setbacks is our ability to adapt and our ability to accommodate.
Ooh, whoa, whoa. What a little boy.
Jackie Jones struggled when she lost 2 family members and suffered a stroke, all in a very short period of time. It was her family and friends, past and present, that kept her going.
You know, when you got 2 choices, you can either sit and worry or get up and do something about it. The voices of my husband, my mom, my sisters and brothers, friends were all saying, hey, it's not over. It's not over.
When Virginia Farino lost her husband, she lost her passion for life, but she found it again in music and an old exercise bike.
There comes a time when you have to make a decision. Are you going to wallow in pity for yourself all your life, or are you going to stop it and then start enjoying it? So, I'm enjoying it.
It was the ability to adapt and accommodate that kept concert pianist Leon Fleischer moving forward when a rare nerve disorder robbed him of the ability to play with one hand.
It is, to a large extent, a question of whether the glass is half empty or half full. If the glass is half full, you suddenly leave yourself open to many more possibilities. So when it's at its worst, you've got to do the tough thing and open up to these possibilities.
So let's all continue to think of the glasses being half full. You know, we've all been thrown curveballs in our life. We know how easy it is to want to give up, but we can learn from those who were able to adapt and accommodate. If you do give life a chance, if you're willing to take a chance, there will be better days ahead.
You've seen that in just some of the examples we shared with you earlier. There's always a way forward in most cases. It's just up to us to find it and also to help others find it when they're struggling as well. We all need encouragement in our lives, and we also need good health care, because when it comes to Medicare, there is no one size fits all. We all have different needs. So let's check back with Kevin Kenny one more time to ask some of our questions and some of yours.
I'm over 65 years old. What if and I'm still working, believe me. What do you say to people that are over 65 and want to continue working? How does Medicare affect or impact them?
Yeah, great question. And Bill, you do not look over 65. And Bill and Mark, I don't ever see you slowing down. In fact, I only see you, speeding up.
Amen.
People can work past 65 and be on their employer-sponsored plan. As long as you have credible coverage, you don't necessarily have to sign up for Medicare. But as you turn 65 and you don't have other coverage, you do need to take that opportunity to sign up for Medicare, because there is a late enrollment penalty if you don't sign up and you don't have other credible coverage.
And there are a lot of people, especially in Florida, who spend part of the year here, but then they go back home. How does that work?
Yeah, same thing. Within the Blues, we have a national network of providers. And so you can come down here and have great care. And as you move to other states, have reciprocating benefits through their network. So the Blues system has something known as Blue Card, which allows you to receive care in your home state and then care where you travel to.
I'm not 65 yet, so I'm right in that age where all of these companies are coming out of the woodwork hoping to get my Medicare business or wanting to have my Medicare policy. What are the key questions? Is one different than another? Are they all the same? And what should I ask to make sure that I'm getting the best deal for me?
Yeah, great question. It's amazing when you turn 64, you never really think about Medicare insurance until that age. And then all of a sudden you're flooded with commercials. You become aware of it, commercials, mailers to your house. So there's a lot of information. And healthcare can be confusing. It's just like purchasing anything else. And because it's such an important decision, there's a little extra weight on you as you make that decision. The key things to look for are, first and foremost, are these the benefits that I need based on my healthcare situation? Are my preferred doctors in the network? Are my drugs covered? But then there's this other, implicit thing. Is it a company that I know and trust and respect and I know will be there for me? And those are some of the intangibles that I think consumers should should look for. I know I practice that same philosophy when I'm, choosing auto insurance or, any other insurance product for my family.
Great follow-up to that is something we've touched on already, and that is the fact that anybody in the state of Florida can go into your neighborhood centers when they're open. Anybody in the state of Florida can access your helplines at any time. So if you do want to get answers to some of the questions that Bill has, and you have some of the same concerns, I suggest that you kind of click on a link below, and we can help connect you with someone from Florida Blue who's not going to give you any hard sales job, but will answer the right questions or answer your questions. And Kevin, I assume that if you kind of talk to somebody and feel that you're not the best company for them, you'll tell them where to go.
Absolutely. We want you to have the best healthcare that works for you. Healthcare is very personalized. And so we want to make sure you're making the best healthcare decisions based on your healthcare needs. So you're absolutely right, Mark. We want you to have what's best for you. I'd love for everybody to have a Florida Blue Medicare policy, but ultimately we want what's best for you. We want the best for all individuals, whether you're a Florida Blue member or not. We are here to support the state of Florida and Floridians. And we want to make sure you have trusted resources that you can go to get credible information. So that's why we've set up a lot of our support mechanisms, is to provide you that credible information. And then ultimately it's up to you. And we hope you choose Florida Blue because of the benefits we provide and the trust in the community and things like that. But we want to make sure that you have the information you make to make the right decision. Because what we believe in our core philosophy is an informed decision is a much better decision based on your circumstances.
Kevin, a personal question, knowing what you know about healthcare, knowing what you know about the industry, are you optimistic that it's going to evolve in a way to better serve? Because every time I talk to someone from Florida Blue, they say we are amazingly concerned about access and affordability, access for everyone. Everyone should have access to quality healthcare, and they should be able to afford it. And let's face it, the great job you guys are doing aside, that's not necessarily the case everywhere today. Are you personally optimistic about the future of healthcare in this country?
I couldn't be more excited about it for a couple reasons. One is I think we've expanded our definition of healthcare. And this is what I love about the Growing Bolder message. Healthcare is not just going to your doctor and being seen for your annual physical and getting a prescription for this. It's a holistic approach to it now. And we truly want to promote that Growing Bolder philosophy of let's make the rest of your life the best of your life. And so as we look at our product development and then the services we want to provide, we are looking to those things that provide additional benefits like, in-home meal delivery services, like Zumba classes in our wellness centers, all of those other things that help us to lead much more fulfilling lives. Those are the things I get excited about because, over my career in healthcare, we broaden the definition of what healthcare really means. And it's exciting to see what the next evolution of that looks like.
Well, I don't know about you, Mark, but I really liked listening to Kevin. It's good to hear that healthcare experts and national thought leaders like Kevin Kenny are optimistic about the future of healthcare, about making it more affordable and more accessible to all of us.
Yeah, that is very encouraging. And folks, if you want to see what the next evolution of healthcare looks like, you are seeing it right now in real time. Companies like Growing Bolder and Florida Blue Medicare working together to not just help you when you're sick, but to help you realize that the best medicine of all is exercise, friendship, and a positive attitude. Something that we saw plenty of last year in Albuquerque at the National Senior Games, where 75-year-old Floridian Joe Johnston, battling a case of altitude sickness and a badly injured knee that would later require surgery, somehow kept his focus together to pull off a stunning win in the pole vault to take the national championship. How much is Growing Bolder responsible for your success today?
The Growing Bolder attitude is responsible for all of it. But you don't understand. I had some of that already. I was just glad I found somebody that's preaching it, man. It's like, yes. I couldn't put it in words. I didn't have the words, but I got the What do you say? I drunk the Kool-Aid, all right.
This is the national champion, Joe Johnston, Apopka, Florida. Badass number one.
You just don't know.
I love Joe Johnson. And Bill, you know, if Joe keeps it up, he will one day become one of our rock stars of aging, men and women in their 90s and 100s that continue to maintain a high quality of life until the very end.
What an impressive guy, Mark. And he's like one of hundreds that we've interviewed over the years to try to learn the secrets, especially the older folks, of their active longevity. And here are 5 big things that we've learned. They all maintain an optimistic outlook. Research shows that if you have a positive attitude, you can live 7.5 years longer than people with a negative attitude. All of them are socially active. Dozens of studies prove that as we age, low socialization can be more harmful to our health than smoking, drinking, or even overeating. Now, these are people that have a passion for learning, a never-ending curiosity about the world we live in. These are things that are great for your health. They find a way to keep moving, even with disabilities. And finally, they get great health care, never missing their doctor visits or their recommended screenings. You know, making the right Medicare plan choice, it's a big step. It's very important to achieving your health and happiness, especially in the decades ahead. Medicare is a great safety net for all of us, but as we said, there's no one size fits all, and picking the plan that's best for you, well, that's a big part of helping you enjoy the decades ahead.
So once again, congratulations on reaching or nearing Medicare age. Growing older is a blessing to be celebrated, an opportunity to be seized. So don't forget to download your copy of Growing Boulder's outrageously interesting and, dare we say, easy to understand guide to Medicare, and head to growingboulder.com/Medicare for more resources to help you make the right individual choice.
Great point. And folks, if you don't already, make sure you follow Growing Boulder on Facebook. Check out our inspiring Growing Boulder magazine at growingboulder.com/magazine, and look for our national TV show on public broadcasting stations near you. Remember, it's never too late to make the rest of your life the best of your life.
Bill, I've enjoyed learning a good bit more about Medicare with you. And of course, our thanks to Kevin Kennedy and all the great folks at Florida Blue Medicare for their passion and their dedication to helping us all age with health and happiness. We'll see you guys around.
Hey, congrats! You were born to be 65. And now that you are, you should know that Growing Boulder has created a simple guide to take the guesswork out of choosing a Florida Blue Medicare Advantage plan. Just click here to get there.